Have you ever felt trapped by the pain and frustration of a whiplash injury? So today we're going to talk about whiplash, the causes, the symptoms, and how do we actually fix it? Well, let me tell you this. If you've ever been in a car accident, which is the most common cause of a whiplash, not talking about a sports injury accident, I want you to know that you're not alone if you question, will I ever be normal? For over 30 years, I've helped thousands of patients recover from neck and back injuries using proven non-surgical corrective treatment programs. In this video, you're going to learn about the real impact of whiplash and how that affects your neck or cervical spine, how hidden injuries, I really want you to pay attention to this, hidden injuries are often causing your symptoms, and I'm going to really talk about the three-step corrective treatment backed by over 360, yes, 360 research publications. By end of this video, you're going to feel confident, understand your injury, and reassured that in the majority of the cases that recovery is possible without drugs, injections, or surgeries, for the majority. Now, I'm Dr. Gregory Kramer. I have over 33 years of clinical experience in taking care of people with a variety of acute and chronic injuries. I'm certified in chiropractic biophysics, which is the #1 research-based corrective care approach in chiropractic. I specialize, like I said, in treating a lot of chronic problems. Now, you've seen on some of my prior videos, we talked about disc problems, chronic neuropathy, chronic knee, and now we're going to talk about both acute, which is a new whiplash or car crash accident, or a chronic. Now, hopefully, if you watch this video, that if you've had a recent injury, you can get immediate treatment. So the sooner you get treatment, the better you become. Now, before I continue with this video, I want you to hit the subscribe button if you want to learn how to eliminate pain, avoid surgery, stabilize your spine so you can live stronger longer. Typically, I upload a new video every week. So what exactly is a whiplash? Whiplash is a neck injury caused by a sudden, forceful snapping motion of the head, propelling it backward and then forward in a rapid sequence. Similar to the motion of a whip being cracked. This typically happens during a car collision, especially a rear-end collision, but it also can occur from sports, falls, or other impacts. So what happens during a whiplash? Well, lots of things can happen. So let's start very simply with the neck. So the neck undergoes a rapid acceleration and then deceleration, and it leads to a really complex biomechanical change. So one of the notable phenomena is the formation of an S-shaped curve when you look at the spine. A normal cervical spine should have a C-shaped curve, not an S. So pay attention to that S, because I'm going to talk about some of the treatment and what to look for on an X-ray. Now, in this configuration, the lower cervical vertebrae experience extension, which is going back, while the upper neck kind of goes forward, called flexion. Now, this force can overstretch and strain the muscles, tendons, ligaments, and even the joints in the cervical spine. So what happens to you? So the most common thing is that we injure the connective tissue or the soft tissue. That means muscles and ligaments can tear, and there's different degrees of tear. Now, obviously, if you injure the things that hold your spine or joints in alignment, you're going to lead to a joint dysfunction. All right, ligaments hold you in alignment. Now, these joints in the neck are called facet joints, and they can be irritated, misaligned, leading to pain, stiffness, and really debilitating pain. Now, the other thing can happen is we can injure the disc, which is in between each vertebrae. And the disc is like a cushion between your spinal bones. So you can have a herniated disc, you can have a bulge, you can have things called a protrusion or extrusion, you can have a fragment to your disc. So basically, the three most common things that happen with a whiplash is either you have a fracture, a ligament injury, or a disc, or sadly, you can have all of the above. Now, you also can injure the brain. Remember, if you have enough force to whip your neck around, you're also affecting your head. So you can also get a closed head injury, and that could be horrific, could be life-threatening. So we're worried about the brain, we're worried about the jaw, we're worried about the spine, and again, the three most common things of the spine is either a fracture of the vertebrae, a ligament injury or the connective tissue, or a disc, or all of the above. Now, we're what are the common symptoms of the whiplash? Well, the most common one is neck pain and stiffness. You start to lose your motion, you have trouble turning your head, you can't hold your head upright. The next most common is headaches, horrible headaches and migraines. The next one is your upper back. If you look at a chart, you'll notice that the upper back is innervated by nerves that come out of the middle and lower spine, okay, the lower cervical spine. You can have weakness or burning, numbness, tingling going down your arms and legs. You can have dizziness, balance disorder, lots of numbness in the arms, and you can also have cognitive and psychological symptoms. So common things of a closed head injury or mild traumatic brain injury would be difficulty concentrating, memory problems, irritability, anxiety, depression. All those things can lead to persistent or chronic pain. Now, obviously, you need to get a checkup every time you get in a car accident. You should not ignore it because small problems turn into big problems. So if you leave it untreated, usually that leads to chronic pain. I've been doing this for over 30 years. I've seen over probably 200,000 to 300,000 visits. And some of the worst injuries, some of the worst problems that people have is when they take a small problem and they don't fix it and it gets worse. So that could lead to postural problems. Your body compensates for pain, poor posture, more long-term discomfort. And then obviously that leads to chronic pain. So again, long-term pain, long-term chronic inflammation, again, leads to persistent, unrelenting neck and back pain. And that also can accelerate the degenerative effects on the spine. So we accelerate the aging process. So if you injure the ligaments, the spine loses its alignment, the force on the joints is uneven force or uneven pressure plus time. So I want you to remember this. You will premature degenerate areas of your body that are misaligned because you have force and time. If you have unequal pressure, unequal force on a joint, it breaks down faster. And I'll show you in a little bit a picture what a normal spine and a spine that had a whiplash injury and how they accelerated the aging process. Now, how do we diagnose this? Well, it's a combination of both your history and physical exam. But the reality is you need to have a physician that specializes in trauma. So number one, they're going to have a consultation. They'll talk to you. They're going to do a physical exam. They're going to test your strength. They're going to check your reflexes. They're going to see, do you have any nerve damage? But also what they're going to do is they should check the range of motion in your neck. They should actually touch your spine. You'd be amazed at some of the patients I see. They go to physicians that don't even touch your spine. So you need someone to check. Is there ligament damage? Do they touch each area of the spine? Do they feel for motion? They feel for swelling? Because usually when something's misaligned, if you touch an area of the spine, usually it'll be tender. And also the doctor should be feeling and trained to feel if each joint has lost some motion. And you're looking for areas that are stuck or immobile, but some parts of your spine will actually move too much. So the three big tests are, you want to check, make sure the brain is cleared from a closed head injury. So many times you'll need to get an MRI of the brain to make sure there's no bleeding involved. Number two, you're going to need to take an x-ray, make sure there's no fracture. You're going to need to do a very important test. It's called a motion x-ray. You need to have your head bend forward and back, side to side, because a motion x-ray will test the ligaments that hold you in alignment. And it's called an excessive motion test. This is by far probably the most important test. And if you're getting pain going down your arms or legs, an MRI would be warranted. So typically x-ray, motion x-ray, and MRI are the key tests to have to diagnose a whiplash. So again, these are some of the critical things that we need to look at. So a whiplash is forward, backward, and forward motion of the spine, injuring bones, ligaments, discs. And again, to summarize, what do we need to diagnose? You need a doctor that's trained in trauma, that touches your spine, tests the nerves for strength, sensation, MRIs, motion x-ray. Those are the typical things we need to do. Now, as far as treatment, I'm going to talk a little bit about that today, and I'm going to give you a couple examples. But my next few videos, I'll go more in detail on our 3-part program that's backed by research to take an abnormal spine and get it as close to normal. So when we look at a spine, we first have to know, is it normal or not? And that's where we look at the x-rays, we look at alignment, we look at movement, and then we talk about, is this normal? If it's not normal, then we need to get as close to normal as possible. We would do very specific adjustments, exercise, and traction. Now I'm going to show you some pictures of the spine and some ways that we help correct that. All right, this is a classic example of the heads going back. So here's a key point. You want your headrest high, top of your head, and close to your head. That's really important to minimizing the damage of the spine. So if this headrest is too low, you're going to stretch and tear the structures. This video or this picture is an example of a normal curve and how the head is going back. This is the S-shaped. Now I want you to pay attention. This is the S-shaped, and now the head is whipping back. Let's go to the next picture. This is another example of an S-shaped. Let's go to the next picture. Now, we see a normal curve. We see this is the jaw. We also see that here's the disc space. Those are good fat disc space. However, you'll see that this is an example of someone that had a whiplash untreated. And they left their spine. Notice how we're losing the curve. You're getting an S shape in the lower cervical spine. Look at the space here. It's a flattened curve. You're getting an S shaped here. Now notice, see how the disc is thin and the bones are rough. Nice fat disc, smooth bones. So healthy joints are fat discs and smooth bones. But if you leave the bones misaligned, if you don't get the proper treatment early, and proper treatment means not just pain relief, means structural correction. We need to restore that curve as soon as possible to prevent chronic pain and degeneration. I want to hammer that point. You need to correct that curve as soon as possible to prevent chronic pain and premature degeneration. This is premature degeneration. Now, let's go to the next slide, and we're going to talk about a very gentle form of traction. So we would clear the spine. We've made sure there's no fracture. We made sure that there's no brain injury. We're just gently distracting the spine. And this generally feels very good for people with neck pain and pain going down their arm. This is the beginning phase. Let's go to the next slide. Now this is spinal decompression. So this is a more advanced form of treatment. So instead of just statically pulling the spine, it's a pump. So there's a computer right here, and what you'll find is that will pump the swelling. This feels awesome. I will have this done to my spine today, so it's great for acute injuries. It's also great for chronic disc problems, herniated, bulging, degenerative disc. So this is the beginning phase of our care, and as you progress, we change the rehabilitation. Let's go to the next slide. Now, remember we talked about the S curve. Well, we need to pull that S out, literally. So we test this type of motion. So we are applying a force. I'm going to mimic this. We're applying a force to the apex of the curve, and then we're gently bringing our head back. Now, if this causes pain, we wouldn't do it. You're not ready for it. But for a lot of people, when we start to pull that S curve into a more normal lordotic or C curve, it feels great. People tell me, God, it takes pressure off. So this is where the x-rays can pinpoint and target your treatment plan. So make sure you find a physician that has certifications in structural rehab. Okay, let's go to the next slide. Now we're looking at a two-way traction. Now this is not going to be it in the beginning. This probably will be after 4 to 8 weeks of pain relief care. We are starting to pull that S curve out. We're starting to distract the neck. This is a two-way traction. And again, all traction should feel good. Nothing should cause pain. We've already cleared them for fracture, and we're making sure that this is comfortable. And again, everything should feel good to you. Now, let's go to the next slide. Now, what can we do at home? Well, this is a type of tracking called a dinero roll. And if you look at this, notice the red line is normal, and the black line represents the misaligned spine. So for this person, we might need to push in the upper neck. For this person, the middle. So in the middle. So it's very specific to you. You cannot order these types of things online and expect a good outcome. You need to get a prescription from a doctor that's certified in corrective care, because it's not one size fits all. It's specific to your alignment, and different people have different alignment patterns. This might be put in the lower neck, the middle neck, or the upper neck. So again, there's a precise way to use corrective exercise and targeted corrective traction. So again, this is a type of thing that you could use at home if prescribed by a doctor. Let's go to the next slide. This is another example of a two-way traction. So again, we do adjustments, which are very targeted applications of force. They're gentle. It's not one size fits all, and the whole goal is to get pressure off the nerves, get pressure off the joints so the body can heal itself. So I hope this information was helpful to you. In our next videos, we're going to go over a little bit more specific details on exercise, adjustments, and traction. In my upcoming videos, I'll go into a little bit more deeper detail into the complexities of whiplash injuries and treatment. Okay, I'm going to show demonstrations of the exercise, adjustments, and traction, and I'll even show what I'm looking for on an x-ray of how we target with exercise, how we target with traction, how we target with specific adjustments or structural rehabilitation techniques, because our whole goal is to restore normal alignment so you can function better. Remember, you cannot roll a square tile, so alignment matters. And I'm going to show you exercises that we recommend to speed up the recovery and prevent long-term issues. So the key point is get an early diagnosis. Do not wait. Find someone that is skilled, certified in structural rehab, that takes a motion x-ray, that gets an MRI, that puts it all together, that uses corrective care approach using adjustments, exercise, traction. Let's make sure you're cleared from a brain injury, okay? So those are all the things we kind of talk about dealing with the whiplash. So if you're really serious about understanding your injury, taking control of your healing, make sure you subscribe so you don't miss these value updates. If you find value in this video, do me a favor, like and share it. And leave a comment below. Share your experience with whiplash injuries. What has been your story, your journey? I always want to hear about that. The next video you need to watch is about one of my patients, about Nancy, her recovery from 10 years of chronic migraines and neck pain caused by a car collision. Remember, early diagnosis, early treatment prevents chronic pain and disability. And also, we'll talk a little bit about how her whiplash was mismanaged, but with the right treatment, found relief and found success, just like many other of the thousands of patients we treat. So go watch this video right here.